I do not mean any disrespect to the field of psychiatry when I say this, but if you are a person who goes to a psychiatrist, I hope you already know, or I want to tell you, you are not going to get the same experience that you would get with a therapist. Typically, psychiatrists might spend a little bit longer with you the first session to do an assessment. And then after that, they're going to spend about 15 minutes with you each time, if that. They are not therapists. There's a good chance that they're going to bring up CBT because that's the one they've heard of as being kind of the gold standard according to empirical data. But in general, they are not familiar with so much that you will get from therapy. For example, if you're neurodivergent, they are not actually very well trained in the idiosyncrasies and the nuances of anything that can come under the umbrella of neurodivergency, including ADHD and autism. I have had a lot of experience with clients coming in and feeling dismissed, honestly, it feels calculated and cold. They know they're just a number, and it's hurtful, it's harmful. So if you're a psychiatrist, try to be aware that some pretty vulnerable people, you should know that, are coming to see you. And if you are too calculated and cold in the way that you ask your questions, which I know you are, you're going through a list. Like if they tell you that they're sad, you're going to say, is that kind of a once or twice a month thing? Or is that a once or twice a year thing? I know you're asking those questions to pinpoint what diagnosis it is and what medication you need. But those questions to someone who is in a really hard place, they feel insensitive. And I get it. You are part of a system that is not very conducive to you caring. Yeah, the system is not conducive to you caring. And I wonder if there's a way within the 15 minutes that more than what is conveyed could be conveyed. I'm not saying all psychiatrists do this, but I hear this so much. And if you are a client, I just encourage you to go to psychiatrist with understanding the reality of what that's going to be. It's not going to be a therapy session. They are probably going to mention CBT to you, which may not even be what you want to use. So I just want to share that because I hear this so much and I feel like it needs to be talked about more. I am positive there are exceptions to this. I am not anti-psychiatrist.